Today I'm sitting down with Dr. Simone. We're talking about, should you push your child to start walking early? Should you?
No.
I don't think so. But
that was a bit too short an answer.
obviously we know
could be done.
you do not want your house turned upside down, so don't push your child to start walking earlier. But there's a purpose to this.
I have the greatest sympathy for parents whose children walk before they ought to. I just feel as though they are just exhausted before their time. But no, look, being mindful of, is your child meeting their developmental milestones from a mobility point of view is really important.
Yeah.
So we like babies to roll over around about from the age of 4 months onwards, to show an interest in sitting at 6 months, crawling 7 to 8 months.
Yes.
Walking can start the earliest is sort of 9, 10 months. Up to 14, 15 months is still well and truly within a normal range for that.
And it's great. It's great if your child does start walking early. Props to you.
Absolutely.
But if they don't, is there some concerns to what we should be looking for if our child is not even wanting to stand up or
So if your child is showing an interest in movement but is a little bit on the slow side, there's a few things that can contribute to that. Babies who are at the higher end of the percentile chart, so bigger babies, tend to take a little bit longer to start moving because there's more bulk to move, there's more mass to move. Smaller babies can sometimes start moving faster, but there's no hard and fast rules with that. But the key is that if your child if you're getting to 9 months and your kid's not even interested in sitting, or if they're not interested in crawling by the time they get to 1, then it's really important that you get that checked out with your doctor in terms of is everything else meeting the appropriate developmental milestones.
So by 12 months, they should be making some attempt to try and stand up?
So, well, if I guess the stage that we talk about as being one of those cruising stages. So not when they're walking independently, but they're pulling themselves up on things, so walking along the edge of a couch or those sorts of things, holding on to something. And if you want to help support them and help them practice that motion, then that's great, absolutely. And developing muscle strength and making sure that they've got great nutrition so that they have all the nutritional elements to be able to support that movement is really important as
I know you talked about some of the concerns if they're not developed. What can we do as parents if we are concerned? Should we go see our GP or...?
So seeing the GP is a great first step. There's really specialised children's physiotherapists who can give us some wonderful tips on how to safely help your child to be more interested in movement. Being on a kid's level and interacting with them at their level, encouraging them when you're down next to them is a really good thing to do. Okay,
but don't force them to start walking at
you're not going to breed the next Usain Bolt that way.
Yeah, so important. Look, thank you so much, Dr. Simone, for sharing some insight on that. I think as parents, you kind of go with common sense, what works for you and what doesn't. But don't force your child to walk. You do not want that. That's a whole different drama. So look, keep it locked right here at Mums at the Table, and don't forget to subscribe to our YouTube channel.